This video is about basic blood compatibility used in transfusion medicine. There are four main blood types: type O, type A, type B, and type AB. Type O red blood cells do not have any antigens on the outside of the red blood cell membrane. Type A red blood cells have the A antigen or A carbohydrate on the outside of the red blood cell membrane. Type B red blood cells have the B antigen, and type AB red blood cells have both the A and B antigens. This is a vial of blood after it has been centrifuged. On the bottom you can see red blood cells, and on the top you can see serum or plasma. We refer to it as plasma when it has been anticoagulated, so we'll continue to refer to this as plasma throughout this video. These snowflake-looking structures inside the plasma are IgM antibodies. People who do not have A or B antigens will naturally produce antibodies to both the A and B antigen. This is usually due to exposure to either bacterial membranes, pollen, or fungi. With that said, people who have O-type blood naturally have anti-A and anti-B antibodies in their plasma. People who are type A naturally have anti-B in their plasma. People who are type B naturally have anti-A antibody in their plasma. And people who are type AB naturally do not have any antibodies in their plasma. There's an asterisk next to none because there are many more red blood cell antigens that we are concerned about in transfusion medicine. This is a list of the different antigens found on the outside of a red blood cell membrane. For example, this D antigen here is synonymous with the Rh or rhesus protein that is found on the red blood cell membrane of people who are Rh positive. And we'll talk more about that when we talk about Rh compatibility. Let's take a look at red blood cell compatibility. On the left, we have red blood cells of a donor, and on the right, we have the plasma of the recipient. Type O red blood cells can be transfused to type O, type A, type B, or type AB individuals and are known as the universal donor. Type A red blood cells can be transfused to either type A or type AB patients. This is because they do not have anti-A in their plasma. Type A donor red blood cells cannot be transfused to either type O or type B patients because they both have anti-A in their plasma, which would react with the A antigen on the red blood cell membrane. This would cause a transfusion reaction. Type B red blood cells can be transfused to either type B or type AB individuals. Type B red blood cells cannot be transfused to either type O or type A individuals because they both produce anti-B antibody that would cause a transfusion reaction with the B antigen on the red blood cell membrane. Type AB red blood cells can only be transfused to type AB individuals. This is because anti-A and anti-B exist on type O, type A, and type B individuals that would interact with the A and B antigens found on the outside of the red blood cell membrane, causing a transfusion reaction. Now let's take a look at plasma compatibility. On the left, we have red blood cells of the recipient, and on the right, we have plasma from the donor units. Type O plasma can only be transfused to type O patients. This is because there are no antigens, A or B antigens, on the outside of the red blood cell membrane that would interact with these antibodies. Type O plasma cannot be transfused to type A, type B, or type AB individuals because type O plasma has both anti-A and anti-B antibodies, which would cause a transfusion reaction. Type A plasma can be transfused to either type O or type A individuals. Type A plasma cannot be transfused to either type B or type AB individuals because of the anti-B would interact with the B antigen on the outside of the red blood cell membrane, causing a transfusion reaction. Type B plasma can be transfused to either type B patients or type O patients. Type B plasma cannot be transfused to either type A or type AB individuals because anti-A would interact with the A antigen found on both of these red blood cell membranes, causing a transfusion reaction. Type AB plasma, also known as the universal donor for plasma, can be transfused to all 4 blood types. This is because there are no anti-A or anti-B antibodies found in this plasma. Now let's look at Rh compatibility. On the left we have donor red blood cells, and on the right we have plasma of the recipient. Rh negative red blood cells can be transfused to either Rh negative or Rh positive recipients. Rh positive red blood cells can only be transfused to Rh positive individuals. Even though there is no antibody present without someone who has been exposed to the Rh antigen, we cannot transfuse Rh positive red blood cells to an Rh negative recipient because they will produce anti-Rh antibody when exposed to the Rh antigen. This will then cause subsequent transfusion reactions. I keep mentioning transfusion reactions. Let's look at the mechanism involved in an acute hemolytic transfusion reaction. There are 2 main types of hemolysis. There's intravascular hemolysis and extravascular hemolysis. Let's take a look at intravascular hemolysis. Here we have red blood cells of a donor that have the A antigen on the red blood cell membrane. So this is type A red blood cells. If we try to transfuse to a type B individual, they will naturally have anti-A IgM antibodies in their plasma. After transfusion, that IgM antibody will attach to the A antigen on the red blood cell membrane. Subsequently, this protein here, referred to as complement, will bind to the IgM antibody. This complement protein is involved in the immune system. It eventually forms what's known as the membrane attack complex, which lyses these red blood cells and releases hemoglobin, which can be biochemically further processed into bilirubin. That hemoglobin can be toxic to the kidneys, and the white blood cell immune response to this reaction releases cytokines, causing the innate immune response of fever and chills. In extravascular hemolysis, we see hemolysis happening in the reticuloendothelial system, or the spleen. Inside the spleen, we have phagocytizing white blood cells. In this case, we have an image of a macrophage, white blood cell. When this red blood cell is sensitized with that IgM antibody, the macrophage recognizes this and goes and phagocytizes or consumes the red blood cell. Subsequently, it causes red blood cell lysis, which releases hemoglobin that can further be biochemically processed into bilirubin. That free hemoglobin can be toxic to the kidneys, and the white blood cell immune response releases cytokines that cause the innate immune response of fever and chills. Thank you for watching this video.